Welcome to Owensboro Health Weight Management. This brief video will help you determine if weight loss surgery might be right for you. We will discuss 2 surgical procedures along with benefits and risks of each, so you can make informed decisions in pursuing your surgical weight loss journey. And with our ACS Surgical Quality Partner designation, you can have confidence you will receive the very best care before and after surgery, right here close to home.
I'm Dr. Ravi Alapati. I'm a board-certified general surgeon and have fellowship training in laparoscopic bariatric surgery. One of the main reasons why I decided to focus on bariatric surgery is that every single one of those obesity-related problems either completely resolve or are greatly improved. There's nothing else that can give me more satisfaction as a surgeon or as a physician than to be able to do one procedure and fix 2, 3, 4 or multiple medical issues that a patient is experiencing. As a surgeon, it cannot get any better than that.
Obesity is associated with serious health conditions known as comorbidities, including diabetes, high blood pressure, high cholesterol, sleep apnea, pulmonary disease, osteoarthritis, depression, stroke, gastric reflux disease, and cancer. Metabolic disease is a combination of diabetes, high blood pressure, and high cholesterol, and is a serious risk for major cardiac events and death. The good news is that each of these weight-related conditions is either completely resolved or significantly easier to manage after bariatric surgery. After having weight loss surgery, 92% of patients with diabetes see either a complete resolution or a reduction in severity of their diabetes. Also, 75% of patients with high blood pressure see reduction or resolution of hypertension. 96% of patients with obstructive sleep apnea no longer need a CPAP or other assistive device. We see a 58% reduction in cardiovascular disease. And of patients with high cholesterol, 76% of them see resolution or reduction of hyperlipidemia. Owensboro Health offers 2 weight loss surgical procedures: the Roux-en-Y gastric bypass and the vertical sleeve gastrectomy. Both are laparoscopic surgeries with low complication rates and short hospital stays. Both procedures begin by accessing the abdominal cavity with small incisions. Trocars are placed to serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscopic or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes which help break the food down into a simpler form so that it can be digested more easily and absorbed in the small bowel. During a gastric bypass, a small pouch is created in the stomach using a stapling device. The small stomach pouch, about the size of an egg, limits the amount of food you can eat before feeling full. The small bowel is separated into 2 sections. The lower portion of the small bowel is attached to the newly created stomach pouch. This allows food to pass directly into the second portion of the small bowel where digestion continues. The upper portion of the small bowel is reconnected to the lower section. Bile and pancreatic fluids from the liver and pancreas allow food to be digested completely. By altering the anatomy of the gastrointestinal tract, gastric bypass results in decreased hunger and increased feelings of fullness after meals. This procedure also decreases the amount of calories and nutrients absorbed by the body. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 and 150 milliliters and is about the size of a banana. The resected portion of the stomach is removed. Bile and pancreatic fluid from the liver and pancreas mix with food and allow it to be completely digested and absorbed in the bowel. By altering the anatomy of the gastrointestinal tract, sleeve gastrectomy results in decreased hunger and increased feelings of fullness after meals. There is no rerouting of the small bowel or postoperative adjustments needed for the sleeve gastrectomy. Both procedures assist with rapid and sustained weight loss by restricting the amount of food that can be consumed. The gastric bypass is both restrictive and malabsorptive, meaning the procedure decreases the amount of calories and nutrients absorbed by the body, aiding in weight loss. Average expected weight loss is slightly greater for gastric bypass as compared to the gastric sleeve. Success of both procedures depends greatly on the patient's commitment to making dietary and lifestyle changes. After surgery, most patients experience rapid weight loss that can continue for 2 or more years after the procedure. On average, during the first 6 months after bariatric surgery, patients lose up to 60% of their excess weight. In the first year, patients lose up to 77% of excess weight. Some weight gain does typically occur in the 2-year range, but we see that the average long-term sustained weight loss for 5 to 10 years is still 50 to 60% of excess weight. Possible complications of both the gastric sleeve and the gastric bypass include abdominal hernias, chest pain and collapsed lung, dehydration, constipation or diarrhea, gallstones, GI inflammation or swelling, stomal obstruction, stretching of the gastric pouch or sleeve, as well as nausea and vomiting. Patients who have Roux-en-Y gastric bypass may also experience dumping syndrome, which is a result of consuming high sugar or high carbohydrate foods or liquids. The symptoms of dumping syndrome are vomiting, nausea, faintness, and diarrhea, experienced all at once. For both procedures, it is important to take vitamin supplements for life, especially gastric bypass patients, because of decreased absorption of food and nutrients. Additional risks that come with any type of surgery include bleeding, pain, pneumonia, complications due to anesthesia and medications, deep vein thrombosis, injury to the stomach, esophagus, or surrounding organs, infection, pulmonary embolism, and death. As you begin your surgical weight loss journey, you will meet one-on-one with your surgeon to determine if weight loss surgery is a good option for you and to discuss which procedure would be best. In the weeks before surgery, you will talk individually with our staff dietitian and behavioral health specialist to help prepare you for weight loss surgery. After surgery, you will meet with our physician assistants who will follow your progress closely. The entire team is here to help you be successful in losing weight and gaining healthier and happier lives. The measure used to determine if someone is overweight or obese is called Body Mass Index, or BMI, which is a calculation of your height compared to your weight. You can determine your body mass index by using the calculator found on our website. To be eligible for weight loss surgery, most health insurance policies require the patient to have a BMI of at least 35, accompanied by significant weight-related health conditions. Patients with a BMI of 40 or greater are generally eligible with or without comorbidities. Many health insurance carriers require patients to have a clinical provider document their attempts to lose weight, usually once a month for 6 months. This is called a supervised weight loss trial. Patients must be free of drug and alcohol problems and have no uncontrolled psychological conditions. Patients must be free of all forms of tobacco use for at least 3 months before having surgery, which includes vaping and dipping. And lastly, patients must commit to a lifestyle of healthful habits and a lifetime of medical follow-ups. To get started, fill out the brief questionnaire at the bottom of this page. If we have not talked with you already, we will contact you to discuss your next steps once we receive your responses. Listen to what our patients say and look at before and after photos on our website, owensborohealth.org/livewell.